Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM, 1080 AM. I'm your host, Francesca Mesiah, Manager of Workforce Development for Kaleida Health. Kaleida, our mission is to advance the health of our community. Kaleida Health is the largest healthcare provider in Western New York, serving the area's 8 counties with state-of-the-art technology and comprehensive healthcare services. We provide services not only to Western New York, we also provide health services to Upper Northwest Pennsylvania and the Olean area. We have hospitals, we also have clinics, and we have our Great Lakes Cancer Care Facility. We have rehab facilities. To me, we have it all. But let me just tell you who our hospitals are. Buffalo General Medical Center, Gates Vascular Institute, DeGraff Memorial Park, Millard Fillmore Suburban, John R. Oishei Children's Hospital, that's Children's Hospital, Bradford Regional Center, and Olean General Hospital. The Visiting Nursing Association, DeGraff and High Point Long-Term Care, and Subacute. All of our sites are accredited by the DNV Healthcare USA. Kaleida Health is committed to diversity and believes our workforce is strengthened by the inclusion of and respect of our differences. Well, moving on with our show. So today I am so excited because, as I said before, not only do we have services from the first day that child enters the world, we also have services for adults. So the first half of our show, we have McKenzie Mattison. Good morning, McKenzie. How are you?
Good morning, Francesca. I'm good. How are you? Thanks for having me.
Oh, you're welcome. And McKenzie is from the John R. Oishei Children's Hospital. And then the second half of our show, we're going to have Andrea Wallace-Steward, who is a vice president and care management of post-acute care transitions. It's adult care, meaning it's a lot to do with discharging once your loved one or once you are discharged from the hospital. But we're going to start with McKenzie, who is a licensed master, has a degree, master's degree in social work, and she's director of our family support services. And I think one day I was thinking about family support services at Children's Hospital. I said, let me call McKenzie for an interview because McKenzie, there are so many support services, and I'm just so glad you've been able to take time because let's just say family support services. Does this include volunteer services?
Absolutely. Yes, it does.
Child life?
Yep. Child life.
Spiritual care?
Spiritual care. Yes.
Social work?
Yes. Social work.
Stones Buddies?
Yep. Our Stones Buddies program.
And healing arts. Are
Yes.
those all part of child life?
No, those are all separate departments at the hospital that each have a different function to support the patient and family while they're here.
And I know we're not going to have time to talk about all of this. And I forgot to let you know that the topic for today is children/family support services part 1. Because there are so many services, yeah. McKenzie, we're not even going to try and jam everything in. I can tell you right now, we're having you back.
So today, I'd be happy to come back. Absolutely.
Oh, I'm so glad. So today we're going to focus on child life, spiritual care, because our listeners are very spiritual,
sure.
And volunteer services. And if time allows, your specialty, social work. So, so let's start with child life.
Sure.
That's what made me think of this program to begin with. What is child life?
Well, Child Life is a very unique service that is unique to children's hospitals. And back in 2006, when I started my career with what was formerly Women and Children's Hospital, I started as a child life specialist. And the work that they do is so essential to the psychosocial and emotional coping of kids while they're hospitalized. They're doing things like medical play. So allowing children to, if they're having a procedure, an IV or an NG, They're able to use actual medical equipment to teach the child about what they're going to experience during that procedure. They're also able to accompany children to procedures where in areas that parents may not be allowed. We're very family-centered here, so we try to allow parents in almost all settings. But as I'm sure you can imagine, there are different procedures and situations where parents are maybe uncomfortable. And so our child life specialist can step in and be with that child throughout their procedure to help them cope with any pain they might experience, but also any fear of being away from their loved one or fear of what's going to happen. So it's really just about dispelling any fears that they have through medical play, through procedural preparation. That means, if they're coming in.
I was just going to say, what does that mean?
Yeah. So if they come in for surgery, for example, we have 2 child life specialists that work in our pre-op area, and they'll show kids the anesthesia mask. They will get to pick a flavor for their anesthesia, which is also
get to do what? You got to slow down just a little. They'll get to do what? That's okay.
They get to pick a flavor for their anesthesia.
Really?
Yes. So that's been really exciting. For the kids, we've been doing that now for, since I've worked here. So it's been ongoing for a long time. And what most people don't know is it's just flavored chapstick, and we can rub it on the inside of the anesthesia mask. So the children are primarily smelling, blue raspberry or strawberry, or their favorite scent that they pick out. So Tara and Claire, who are working in our pre-op area, are every day spending their day teaching kids about having surgery so that when they go back to the operating room with their nurse and with their doctor, they're less afraid and they know what to expect.
And if they're going into the operating room, that also means that they're left without their parents as well.
Yes, absolutely. And Tara and Claire can go into the operating room with the children prior to the anesthesia induction, and they do that pretty frequently. So it's a nice service that we have down there. It certainly helps to reduce the stress and anxiety of, having surgery, being in the hospital up on the floors. We have child life specialists in all of our inpatient areas as well. And there's also some fun. There's a fun component to the work they do because they oversee our playrooms. They oversee all of our donations to make sure that we have developmentally appropriate toys for kids in the hospital so that it really normalizes the hospital experience when they're able to continue to play and learn through play and have those items that they enjoy using at home, here at the hospital as well.
And they may even have items at the hospital that they don't have at home.
That's true.
Which in some cases, you might get a child who doesn't want to leave because they're having such a good time.
That happens all the time. We call it the Get Well Hotel.
Oh my God.
And we do have children who love it so much that they don't want to leave, which is obviously a good outcome for us. We know that we've made them comfortable. And we know that kids heal faster when they're comfortable and they know what's happening with their bodies.
Mm-hmm. So now does Child Life, and I may have missed it, do they also work with the parents who might be feeling stressed about their little person in surgery?
Yeah, what we find is that when parents are anxious, kids are anxious.
Yes.
So just, I think, innately in what the child life specialist does when they're preparing a child for surgery or preparing them for a procedure or explaining a new diagnosis, it helps to also relieve some of that stress and anxiety from the parent as well. And overall, that's better for the child's coping.
Mm-hmm. Mm-hmm. So, and I have to say that the space, if you've never been to Children's Hospital, because it's connected to Buffalo General Medical Center, and it's very bright, it's very airy. There are all kind of places for parents to sit with their kids. I'm always saying hello to little people and their parents. And it is a very warm environment. And that's not even the patient floor. So I'm sure that's even more beautiful.
Yes, we're very fortunate. I mean, that's really thanks to our Healing Arts Committee, which includes child life specialists to provide insight on what is kid appropriate and kid friendly. but yes, that's really translated throughout the entire facility, making sure that we have artwork that's local, but that is also kid and family friendly to make
Yes.
people feel comfortable.
Yeah, no, it's really nice. We're probably going to come back to um, child life because it's such an integral part of, to me, of Children's Hospital. But how about spiritual care? How does spiritual care impact? How do they work with child life?
Well, we're so fortunate to have such a strong spiritual care team here at Oishei, and it is such an integral part of the work that we do with families because, as you know, and I'm sure as all of our listeners know, faith is just a kind of fundamental and foundational to people's lives and families here in our community. Um, so we have Tom Baldwin, who is our spiritual care coordinator, and
Who is your spirit? Who is that again?
his name is Tom Baldwin,
Oh, okay, Tom Baldwin.
and he is a pastor by trade of a
Mhm.
local church, and chose to come here. He served as a chaplain with us for years, and then chose to come as a coordinator to help us really grow our spiritual care program.
Mhm.
And he's been able to foster relationships within the community with many different faiths,
Mhm.
Muslim, Jehovah's Witness, families
Baptist.
of yes, families of the Jewish faith,
Mhm.
families of all denominations of Christianity. And so it's been a wonderful opportunity for us to really meet families where they're at, but also provide, appropriate support from their own faith path. So we have a beautiful chapel on our fifth floor, and we've really worked hard to make it a safe space and one of peace for families to spend time there when they need to take a break or to say a prayer.
Now, and I know there's also right across the bridge, connected by the on the second floor. I know there is a great chapel at Buffalo General
Yep,
Medical Center. Our parents or family members also allowed to walk across, the enclosed bridge and go
yep,
and visit that? Okay.
yes, yes, absolutely. We share our cafeteria with Buffalo General. So families are definitely encouraged to walk across the bridge. Certainly can use that chapel space if they'd like to, and vice versa. If folks from Buffalo General want to use our chapel space, we're always open to that as well.
Yeah, no, it's really it's a very nice experience. Well, it really is. How about our next area, volunteer? Now, because I know volunteer services are huge at all of our Kaleida sites.
Yes.
And I always have people ask, well, if I volunteer at Buffalo General Medical Center, does that mean that I can volunteer at Oishei Children's Hospital, or is that a separate application? And I'm going to ask that to you as a question. If they apply at Buffalo General Medical Center under Father Richard, is that the same as applying to volunteer at Oishei Children's Hospital?
So we all use the same application.
Mhm.
Kristen Williams is our supervisor of family support services, and she directly oversees our volunteers now, which obviously still under my oversight. It's the same application. So if Father Richard has a volunteer at Buffalo General that would like to volunteer at Oishei, we do this all the time. He'll just send the record over to us or make a copy and give us the records that they have, because obviously we all have to do a background check on our volunteers. We have specific trainings that they need to go through. There's a medical clearance involved. So they don't have to go through all of that again to volunteer at Oishei, but we do need those records so that we kind of have verification that they've been, gone through that process. And then we also like to do an orientation to Oishei, because working with kids is a little different than adults, and there are some nuances to it. So, Kristen would then provide them an orientation to Oishei, and get them ready to go. So it's certainly an opportunity, but we don't allow. And Father Richard, and I are, and Kristen are in pretty frequent communication that we don't want any of our volunteers to just walk over to Buffalo General because they don't really know the facility, and we don't want any of his volunteers to just walk over to Oishei. But we're certainly happy to have them volunteer at either location. They just do have to connect with either Father Richard or Kristen prior to making that change.
Yeah, and you know what, and I always wondered how that worked.
It's very seamless, very seamless. So it's just a matter of scanning over the record, and then we're able to take it from there. So
I know for volunteering, I know there's an area, or it used to be an area. I don't know if it's still there. It's the area where people volunteer to hold like babies who are is it
yes, in our
ICU
NICU.
babies?
Yes.
Yeah. Is it NICU? Okay.
Yes, in our neonatal intensive care unit, we do have a pretty extensive rocker program.
Rocker, that's what it
yes.
is, not porch sitters, rocker.
Yes. With volunteers who come and will rock babies or hold babies. There's also a big component of reading stories to them, even at their bedside, to help to just have a friendly voice. It's so important with their development that they're hearing talking and words and engaging with someone, even if they are, intubated and not able to respond. It's just still a very important interaction for babies. So we do have child life specialists in our NICU, along with social workers that are, working with parents to help them cope with that. But also our volunteers play a tremendous role in interacting with those babies and helping them feel comfort and love while they're in our NICU.
Something that you just said, I just thought of, you said that they even read to the student, to the babies. How is this determined? Like, at what age? Is it research based that some of the decisions are made on what is an age if if a child is incubated? Is there what's the research on that? The data?
Oh my goodness. Well, that's a loaded question.
Well, it must be something that's proven,
Yeah.
Yeah.
Yeah, absolutely. I think the value of human touch when we're talking about development, there's been a lot of research over the years by psychologists about healthy interaction and bonding with babies when they're little. The reading of stories and the hearing the kind of intonations and the normal kind of conversational talking is very important for their brain development as well. And so we just encourage the babies to do whatever they can that's within their that's developmentally appropriate and within their milestones at their adjusted age, to help them to flourish and to heal. And we know that when the psychosocial, the emotional, the developmental needs are being of children and especially neonates are being attended to, that it's helping them to heal faster.
Yeah, and you know what? That is so important, that healing, because I know that also goes for all ages, and that human touch. I always read about human touch and in terms of with children. I don't have any children, but I love them.
Same.
They're great little people. They're great little people.
They are.
Yeah, and it's just so now if say two friends, let's say two friends are retired and they were looking for something to do, what would you tell them?
I would tell them to give us a call here at Oishei if they're interested in volunteering. We have a lot of events throughout the year that we utilize volunteers for, like our golf tournaments, but also our Festival of Trees in December. But if they're interested in coming in on a weekly basis or a bi-weekly basis to volunteer with the children, we would welcome them to reach out to us. They could call our main volunteer office for more information.
And what's that number? What is that number?
Sure, it's 716-323-2420.
One more time, please.
716 323-2420.
And so then they would come in, and would they fill out the application there, or can they get it online?
They
And
can, if they go to KaleidaHealth.org under ways to help, you'll see the volunteer application right there.
then how long before they hear from you or the person who's in charge of the volunteer office?
I would say usually within a week of receiving their application, we're reaching out to them to set up a meeting or an interview and getting the process moving.
Now, is there any time of the year when you are in need of volunteers more so than any other time, or is it year round? How does that work?
We take volunteers year round. During the summertime, we do have a high school summer program for youth who are 15 and up and older coming to volunteer in the summer. So we're pretty volunteer heavy during the summer months, but certainly in the fall, in the winter time, we'll take an application any time of the year. And our big volunteer initiative, Festival of Trees, takes place in December. It's a beautiful event. We're
It
always
is.
looking for community members who are willing to volunteer for that event as well. So yes, any time is a good time to reach out.
So what if they're interested in rocking babies and holding little ones?
Well, that is our most popular placement. So we do have a little bit of a wait list for
Oh,
the
we
baby
do.
rocker program, but
Mm-hmm.
that shouldn't discourage you from calling because we have babies on all of our floors.
Yes.
We have babies on the 10th floor and the 11th floor, even the 12th floor sometimes. So we have lots of kids who need attention, lots of kids who need support. So we would love to have you come and join our team.
You know what I didn't ask you? What are the ages of children for Children's Hospital? When are they considered an adult?
21. So we see babies age birth through 21, or children or young adults ages birth through 21 here at Oishei.
Mm-hmm. Mm-hmm. Yeah.
Yep.
Oh, okay. And now we have a little bit of time left. Let's talk about oh, I know what question I wanted to ask.
Sure.
The Buffalo Bills, like when watching the Bills game, and you'll see for a touchdown, and it goes towards is it Mary Allen? Is that Josh Allen's grandmother's
Oh,
name?
yeah, the Patricia Allen Fund.
Patricia.
Yes. Um, yeah, absolutely. Josh Allen is obviously a huge supporter of Oishei. We're so thankful for his support in developing the Patricia Allen Fund, which has brought in tremendous support for our teams here at Oishei. Also, Eric Wood is a former Buffalo Bills player. You see him on the news. I think he's usually pretty active at the games. He has the Evan Wood Fund in honor of his younger brother, which directly supports our family support services here at Oishei. So the Bills are tremendous supporters of Oishei. We're so fortunate to have folks like Josh and like Eric actively engaged, actively supporting the patients and families here at Oishei. So yeah, we're very fortunate. We're very blessed.
That is wonderful, because I always want, and that's a question I get quite a bit in the community, and I also share with people. I think people get so caught up in the touchdown
Yes, you're
or
right.
the field goal, and
Yes,
they miss that part about money, about the touchdown, the whatever the dollar amount is going towards the Patricia Allen Fund, and they
yeah,
may not really know because you get caught up in the excitement.
yeah.
So what are some of the things that the Patricia Allen Fund, what 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 do they what do they do? Is it part
Yeah,
of? Mhm.
it's really focused on our trauma program here. So
Oh.
I think it's been utilized to purchase state-of-the-art equipment
Mhm.
that any patient experiencing a medical trauma may interact with if they need to have surgery here related to their trauma.
Mhm.
Um, I think, we have the Patricia Allen wing up on the 10th floor of Oishei, and a lot of our surgical patients end up there on the 10th floor. And so that's really the Patricia Allen Fund's focus. And the foundation, our team at the foundation certainly can speak probably more eloquently than I can to that fund in particular, but I know it's done tremendous good here at Oishei, and has impacted countless lives and countless families directly with the donations from our super generous community.
And thank you. And another question that I get a lot in the community now, now you have me thinking about the questions are a lot of times student groups, high school students want to tour the hospital. And what I always say to them, because I know it was shared with me a while ago, that our children, their immune systems aren't as strong as let's say a teenager, an 18-year-old and or an adult. And that's one of the major reasons why we don't have tours walking through, but I do encourage the volunteer service people to volunteer.
Yes.
Is that true? Is
Yeah,
that
I
true?
mean, particularly in the summer months when we're not seeing cold and flu, when we're not seeing RSV, when we're not seeing all of those, viruses that really kind of go rampant during the wintertime, we would love to have high school students who are 15 and older come and volunteer and work with the kids. I think during the year, we do our best to accommodate tours as we're able to, but we really also want to keep this as a space of rest and peace for the children who are here recovering. And to your point, Francesca, yes, like a high school student's immune system isn't as well developed as yours or mine. And especially if we're seeing a lot of cold and flu during those seasons, which essentially start in October and go through April, we're pretty selective about the folks that we have touring the facility. So it's really a protective factor for the kids, but also for our patients.
Right. And the families as well.
Absolutely. Absolutely.
It's all about respecting the privacy
Yes. Yes.
and you want a group of people looking at you, your child, the parent,
Right.
it's just another level. We have about 1.5 minutes left.
Okay.
And what are the primary, if someone's listening to this and said, wow, you have a really cool job, what are some of the primary steps you would tell someone in having this huge, and like I said, we just scratched the surface of what you do. Steps and the career development, what would you say?
Well, I have been really fortunate here at Kaleida to have some tremendous mentors who have supported me along my journey here at Oishei and here at the old hospital, starting as a child life specialist, working as a social worker, taking a shot to become the manager of child life and volunteer services, and kind of continuing to grow our family support team to what it is today. I don't know that I have a specific path or trajectory, but I would say being open to learning, being open to feedback, being and really latching on to people who take their time to mentor you. So, Allegra historically was a great mentor. Pam Trevino is the current person I report to, and our Chief Quality and Safety Officer. She has been tremendous to me. And so taking all opportunity to learn and to grow and hearing that feedback. And it's helped that I've done almost every job that I oversee now, because I have a pretty good perspective on the day-to-day of everyone that works for me. So, and I have a great team, Francesca. We have the best team here.
We do. And on that note, McKenzie, Mattison, Licensed Master Social Work, Director of Family Support Services. I want to say thank you so much for the first part of our program on children, families, and family support services. I will have you back in about another month or so we can talk about the rest. And I want to say thank you for being our first guest this morning on the Great Lakes Health radio program. And listeners, hold on. Within 15 seconds, we have the second half of our program talking about one of our adult services at the hospital. Thank you, McKenzie.
Oh, thanks so much for having me, Francesca. Have a great day.
And now on to part two. And welcome back to the second half of the Great Lakes Health radio program. And our topic for today I believe is a relatively new topic or new department within Kaleida Health. And our topic for today is care management and post-acute care transitions. And our guest for today is one of my colleagues who's relatively new with Kaleida. I don't think you've been here a year, Andrea Wallace-Steward. Good morning, Andrea. How are you?
Good morning. Thank you so much for having me.
You're welcome. And how long have you been with Kaleida Health?
I've been with Kaleida since August 2024, so about 7 months.
About 7 months. So welcome to Western New York.
Thank you. I love it. It is so beautiful, and the people here are just so welcoming. I'm so blessed to be here. Thank you.
Oh, great. I'm glad. Well, first of all, and Andrea, I want to introduce who she is within Kaleida and what hat she wears. She is the vice president of care management and post acute care transitions. Did I get it right?
Yes, Vice President of Care Management and Post-Acute Care Transitions for the entire health system, Kaleida Health System.
And so on that note, if you could please describe what is care management and post-acute care transitions? And it's like a two-part question. And how does this affect patients and their families at Kaleida Health?
Great question. So even though it's a really big title, it's two parts. So care management really deals with making sure that the patient's care is coordinated and adequate, not only throughout their hospitalization, but it's also once they're discharged, making sure that they are transitioned from the hospital into the most appropriate level of care in the community to ensure that they're getting the services that they need, that they're healthy, that they're whole. And it's not just the patient, and it also includes the family, because the family is the best support for the patient. So it's care management in the hospital, but also when it comes to post-acute care transitions, once the patient is being discharged back into the community, making sure that they have the services they need. They're in the most appropriate level of care, whether it's home with home care, whether it's at another facility that best meets their needs to ensure that they have the best outcomes.
So okay, and then going from there. So does care management work with the discharge department? Because I know when you talk about really, you have that loved one in the hospital, and they say to you, okay, they're ready to go home, and you kind of think, who determined this? So do you work with the discharge department? And if yes, how are the next decisions made if someone is to go into, let's say, go to High Point or DeGraff, or if they're to go home, or if not their home, to their home with their sister or their daughter or son?
Excellent question. In regards to discharge planners, the patient care management department is made up of RN patient care coordinators and social workers. So when you're saying, well, who decides where a patient goes? That decision is made by the multidisciplinary team, of which patient care management, meaning the RN patient care coordinators and social workers, are an intrinsic part. What happens is the provider, whether it's a physician or a physician assistant or the nurse practitioner, that is the person who will ultimately decide where that patient goes based on their medical surgical status, how they're doing, what they need. But here's the thing, they don't make that decision alone. They
Okay.
need the input of physical therapy. They need the input of RN patient care management and social work in regards to, okay, their medical benefits and what the best discharge plan is for them. We are the subject matter experts in regards to discharge planning. That's what patient care management is. However, we do not work in silos. We need the collaboration of our multidisciplinary team, like physical therapy, like nursing, like nutrition, as well as consultants, specialty consultants. And at that point, all of us together will make a recommendation to the provider who ultimately has the marching orders and directs everyone, okay, based on what everyone's saying, the patient's going to go home with home care. The patient's going to go to a post-acute care facility, whether it's a long-term acute care hospital or it's a skilled nursing facility for long-term placement or for subacute rehab. So while we play a very intrinsic part in discharge planning, the person who ultimately makes the decision is the provider.
Now how about the only person you didn't mention in this is the family? Where does the family come in with the decision, or doesn't? Or I know the family has some. I'm assuming the family has some type of a role in the patient, or don't they have a role in this?
No, absolutely. And when I say patient, and that's just what I usually do. When I say patient, I automatically mean patient and family, because everyone has a support system. Everyone has their idea of family. So when I say patient, I totally mean patient family. So of course, we always include the next of kin, the emergency contact, healthcare provider, healthcare proxy, or power of attorney, but just the patient support system, because you have to include them. The patient is not going to stay in the hospital, and we need to know what support they have in the community to make a determination what the best discharge plan is for them. So, for instance, if a patient only has a granddaughter who's still in high school,
Right.
okay, that's their family, but having them go home with home care may not be the best option when their acuity of illness or what they need is that 16-year-old is not going to be able to help them. So we definitely always bring the family involved. Bring the family into it. And the family is a great resource, an awesome resource.
Yes.
And we need our families to let us know, hey, I know you think that patient can go home, but let me tell you why they can't. We work 24 hours. They can't cook their own meals. They live on a third story walk up. So we need that vital information. We can't do a discharge plan without a family. Absolutely.
Yeah, thank you. And for our listeners, one very important thing I forgot to include, and Andrea, that's our guest for today from Kaleida, Andrea Wallace-Steward's title. You may think, how does she know all this? Because Andrea has a bachelor's in nursing, and she's a registered nurse, and also has a degree or certificate, you tell me, in care management coordination. So she is an expert in this area and has been trained in this area and working in this area with patients and family and where to place them for several years. So she's new to Kaleida, but not new in her knowledge and what she's been doing. Correct?
Yes, ma'am. I found my niche in care coordination and case management in 1996. So I've been doing it a while in very big hospital health systems, as well as on the insurance end. And I do have a certification in case management that I've held since 2006. I'm also a member of the American College of Healthcare Executives. And the great thing about case management is that you see the patient and the family from before they even get into the institution or the hospital or whatever healthcare setting that they need to get into, to them going to the community back home, whether it's home or a different type of home that they normally are used to. So it's very gratifying. It's very gratifying. You also include population health, which is part of our post-acute care strategy here at Kaleida Health.
And you know what? That's a word. Post-acute care. That is a hospital term. What does post-acute care mean? When you just, you just said the word, but everyone may not understand what that means. Yeah.
Yes, ma'am. So post-acute care basically means the care that's being arranged and coordinated for the patient to go back into the community. So it's after the patient has finished their hospital course, that's where post, meaning after, acute, meaning hospital, and care. So it's basically after the hospital care is completed, now there's a different care that's needed to support this patient in the community.
Mm-hmm. And Andrea, let me ask. So I don't want or I don't want our listeners to think that if their loved one does need to go into a long-term care facility for rehab, I don't want them to think that they necessarily stay there, and vice versa. If they come home and they realize that they have some limitations, they may go back. So let's say, I'll just take it the first step, which is once you're in a facility, long-term care facility, can you go home, or is that your home for the rest of your life?
Oh, no. So thank you so much for that question. And that's a really good question because, I really think the general public needs education around this. And so I'm happy to provide it. So thank you for that question. So here's the thing. When patients and family come into the hospital, sometimes we have those instances where they get into the hospital and the patient and family together have decided, you know what, there's no way we can bring mom back home. She needs to go into a subacute rehab. Okay, what a subacute rehab is the patient's going to go into a skilled nursing facility for a very short time, usually 20 days, somewhere around 20 days or more, to get rehabilitated and then be transitioned home, probably with home care, depending on what their needs are. Here's the thing. When you go to a subacute rehab, it's not for the long-term placement, not initially. Now, let's say a patient comes into the hospital, has surgery, they clearly need some subacute rehab to get rehabilitated before they go home. They get into the rehab, and then it's like maybe there's some medical or physical changes. And as a result, we've tried to rehabilitate mom or dad. Seems that they're not going to be able to go home. So then the patient can be considered for long-term placement. But again, that's a total decision. That's a total different decision that has to be discussed with the patient, the patient's family. And again, the great thing about going into not a great thing about going into a subacute rehab, but the great thing about transitioning to different levels of care is that they have meetings. They have comprehensive care plan, comprehensive family planning meetings, so everyone can have this discussion to say, okay, this is what mom, dad is doing now. This is where we're trying to get them to go. Again, a care plan is a living, breathing thing. It evolves, and it's based on what our patient is doing, and that will determine where they go in regards to the support that's in the community. So to shorten it, just because you go into a subacute rehab does not mean that you're gonna, that's the place where you live. Absolutely not. And let's say you go home with home care, just the other side of the coin, like you were saying, you go home, you discharged home with home care, and you find out, wait a minute, we thought mom, dad, was able to do this, but clearly they can't. Here's the great thing. Here at Kaleida Health, we have the Great Lakes Integrated Network, where prior to the patient leaving to go home with home care, we connect them with our Great Lakes Integrated Network to make sure that they have services, like they're connected with community services to ensure that they are supported in the home care setting. So let's say they go home and they can't function. We connect them with VNA, our Visiting Nurse Association. They're one of our preferred providers for home care, and they're in our preferred provider network. And again, a patient is screened before they leave to make sure that they're going to be able to function at home. The home care agency will not accept the patient if their needs are greater than what the home care agency can provide. And at that point, again, a discussion is had to say, maybe they need to go into a facility just to get some rehabilitation to make sure that they're at their best level and can function home with home care.
Yeah, and then also sometimes it's a matter of maybe that when that person was discharged, let's say that person was the person who was responsible for them at home, maybe they weren't working, maybe they had taken an extended vacation, maybe they had to return to college or to the military, and then they realized that that was the person who was helping. So again, it's a family decision, and that's where if there's no one there at the house to help like they were when they were first discharged, that's where again you have a family conversation. Now, do they have it with you, or do they have it with someone from your team? Who do they?
They have those conversations with the RN patient care coordinator and or the social worker. And then, to be honest with you, what we're doing now with our restructuring of multidisciplinary rounds, again, that's where the whole team gets together to discuss each and every patient to make sure that their treatment plan and their discharge plan is individualized, fitting that patient and family. Because again, we are very patient-centered here at Kaleida. It's not just, room 200, the hip replacement. No, it's patient Andrea Wallace-Steward and all the things that make Andrea unique and what that person's unique individual treatment and discharge plan is, including their resources.
Andrea, you definitely have given us a true vocabulary test today, and that's why I'm going to ask you if you could define. That's okay. No. That's why. I mean, I always stop everyone and all the guests. Treatment plan. Now, what is a treatment plan, and does the family have? What is a treatment plan? Who is part of a treatment plan? Because that's very important. Treatment plan. And if you could just talk a little bit about what is a treatment plan, is there family involvement? So if I'm taking a multiple choice test, check all that apply to a treatment plan. What would I check?
Okay, so anytime you go into the hospital and you have a diagnosis, we're treating Miss Smith for congestive heart failure. Okay, I'm just pulling that out of the air. When we're meeting for multidisciplinary rounds, excuse me, when we're meeting for multidisciplinary rounds, and that means the whole team is meeting, the provider is coming to us with a treatment plan. The treatment plan is, okay, Ms. Smith has congestive heart failure, so her treatment plan is we're going there. It's like the recipe of how we're going to take care of the patient. So
it's the recipe.
it's the recipe. It's the recipe that the chef, aka provider, is saying, well, we need to make sure these labs are okay. We need to make sure that this medication is doing its job. And the goals of care, meaning what we need to achieve to make Miss Smith better, is met. So we need to make sure that her labs are within these values. She's able to ambulate because she has to go home, and for 12 hours, she's going to be by herself. So is she able to wash herself, take care of herself, groom herself, cook her meals? Again, the treatment plan is the recipe for how we are going to take care of the patient.
And the family has an input in that as well.
The family has an input in everything, because again, we take what the family, we take the information that the family provides us to help guide us with the recipe. But the thing about it is the family has if a patient has congestive heart failure, the family isn't going to say, okay, well, you're going to put them on those medications. No, that's the provider. Do you see what I'm saying?
Yes.
So it's really provider driven. It's really provider driven. Now, if the provider wants to put the patient on some IV antibiotic or IV infusion medication, well, we're going to take what the family has to say in account, because maybe there isn't family at home that can help do this. You understand what I'm saying?
Yes, absolutely. And I definitely have seen that. Have seen that happen. So when you talk, so when the patient goes into, let's say, long-term care, let's say they've had a stroke. It wasn't a bad stroke, but they just needed to regain their strength because they hadn't gotten up and walked in a while. But is there someone within your department who goes, because what we want to prevent the patient coming back into the hospital. That's all part of why we have this care management team. Listeners, we want to prevent your loved one from coming back into the hospital. So after so many weeks, is there someone from your team who then follows up with that long-term care facility or the BNA to see how progress is going?
Yes, and that's a very good point. Reducing readmissions or preventing readmissions is always best practice and optimal outcomes for the patient, for the family, for all involved. Having patients come in and out of the hospital is never, a best practice for their care. And as you know, Kaleida Health is patient-centered. What happens is, again, when a patient is discharged and they have visiting nurse association, again, they're one of our preferred providers. They always follow up with us in regards to how the patient is doing. Okay, if a patient is going into a subacute rehab, because subacute rehab is very different than long-term placement, the patient's going from the hospital to long-term care, the skilled nursing facility is their new home. Okay,
Yes.
If the patient's going for subacute rehab, they're just going for a certain amount of time, and then hopefully they will be transitioned home with home care. Again, if they're using our preferred provider facilities, our post-acute care network, then yes, we have continuity of care because our providers have privileges at those facilities, and we have a better eye in regards to, okay, Miss Smith who broke her hip or Mr. Smith who had the stroke, okay, right. He's under Dr. Shields, who's a provider there. We can definitely have follow-up.
Thank you. You know what? We only have about 2 more minutes left in the program, or maybe about 3 more minutes. And my question is, because what you do to me is fascinating, and that's how we started this conversation for the interview. So what steps have you taken towards your success? I see you as a success. Not only are you a success, you bring success to the hospital. So, what are some of your steps that you've taken that if someone is listening in high school, post high school, in the middle, what steps should they take to follow in your footsteps?
Okay, well, thank you for that. In regards to the successes that I have assisted in achieving here at Kaleida Health, again, length of stay is a really important issue because the longer a patient stays in the hospital, um, it's not the most optimum outcome. We want patients home sooner because we have found, and as best practice, that the sooner the patient goes home, again, they convalesce and they get better quicker. Some of the things that I have assisted with is, again, restructuring our multidisciplinary rounds to make sure that they are efficient and effective. As making sure that our RN patient care coordinators are asking the right questions and that they are operating at their top of their license for our patients and families. And as a result, at Buffalo General, we have seen a decrease in length of stay from December 2024 to March right now. We are also predicting discharges earlier. So now our RN patient care coordinators and social work teams are predicting, well, this patient is going to be going home tomorrow or will be leaving our hospital. So we want to make sure that everything is together to make that transition as smooth as possible. For anyone that wants to follow in my footsteps, first thing I would say is make sure that you are serving in healthcare for the right reasons. This is not great. This is not Grey's Anatomy. This is, no, ER. No, that's fiction. That's drama. People don't have time for all of those relationships. Yeah, we're busy working and taking care of the patient. So that's number one. Make sure you're doing it for the right reasons. The right reasons is you want to help people. And you don't find sacrifice as an issue. Because you're going to have to sacrifice your time, your effort, your energy for the greater good.
And you know what, Andrea? On that note, I'm going to say we're going to have to end, but I want to let listeners understand what she just said. Working in healthcare, it's about sacrificing your time and your energy for the greater good. I like that quote. Can you write that down and I can use that again?
I will send that to you in an email.
Thank you. And so our guest for this morning has been Andrea Wallace-Steward, a nurse at Kaleida Health, and she is a vice president of care management and post-acute transitions. I'm going to tell you, I will repeat this program at least one other time within this year because there's a lot of great information, a lot of great terminology, and this program definitely involves the family, making sure your loved one is as safe and healthy once they leave the hospital. I'm your host for today, Francesca Mesiah, Manager, Workforce Development. Next week, you'll hear from my esteemed colleague, Cindy Bass from ECMC, Erie County Medical Center. Until then, be safe and have a great week. Bye-bye.